it is the Canadian Mental Health Week. I know that there's a lot of history. I can't remember how many years ago. I think, Jack, you told me in the prep call, but maybe Mark and Jack, you can give us just a bit of background, like what is Mental Health Week? How long has it been around for?
Yeah, so go ahead, Mark, tell away.
Yeah, just to let people know that CMHA National's been around for 102 years. It celebrated its birthday. It's the longest standing nonprofit organization in Canada. But Mental Health Week, it's a Canadian tradition, and it's been established by CMHA in 1951. So we're looking at this year marking our 70th annual CMHA Mental Health Week. And Mental Health Week began as an anti-stigma event way back, and it's grown from there. As recent as the other day, Prime Minister Trudeau issued a statement on Mental Health Week saying that we need to be there for each other during this time and normalize talking about our mental health openly. We see you and you're not alone. So that was a quote from Prime Minister Trudeau. And I mean, given the difficult times we've all been in for the last 15 months, it's so true. It hits home. I also want to just clarify that Mental Health Week's not to be confused with Mental Illness Awareness Week, which is actually, that occurs the first week in October. So this year it's October 3rd to October 9th.
I think, yeah, and just to add on that, Nicole, and Mark's got all the stats and numbers and dates. This is why he's the boss. But again, I think about it launching in 1951, and you think, an anti-stigma event and how much more it's sort of grown into now. And like Mark's saying, like the Prime Minister now, and look at us here right now. We've got 1,100 people in a room listening about Mental Health Week and mental health awareness and talking about their mental health. And what a cool opportunity this is to really promote wellness for everybody.
No, it is. And Jack, you were the inaugural virtual Leader Chat guest with me, where we wanted to really, on Bell Let's Talk Day, and really, let's get rid of the stigma. And so I think as an organization, we've come a long way, but there's still work to do. I think we would all agree with that.
There's work to do in all aspects and all levels, but I think an organization that starts at the top and has a trickle-down effect of anti-stigma, promoting mental wellness, promoting, again, 50-minute, 25-minute meetings. I think I know what I'm bringing up at my next management meeting, boss. And promoting wellness for everybody, because again, mentally healthy employees are effective employees. If we can have healthy people, we can have effective people. So I think that's really cool.
No, it's amazing.
Yeah, and I think the more we can recognize it exists, we all have mental health, whether we're well or we're not well, but we all have mental wellness, mental health. And it impacts us all. So,
absolutely. Now that this year has a theme with Mental Health Week, and I believe it's "Name It, Don't Numb It," which I think is really really interesting, because in all the reading that I've done, just identifying with your emotions and understanding emotions, and a new term that I just learned recently is emotional literacy. So I'm hoping one of you can sort of walk us through, both the theme of this year's Mental Health Week as well as emotional literacy.
I'll start, and Jack will probably chime in. He does this every day. He talks mental health, mental wellness. That's his job. The term emotional literacy for me is really looking at people's ability to recognize, understand, label, and express your own feelings. And what that really means is, in simple terms, is I feel sad, or I feel happy today, or I feel joy, or I feel angry, whatever that means. Emotions like sadness and anger are sometimes considered bad or negative, and those are negative emotions. However, those emotions are important because they make up us as individuals. So we can learn and accept our emotions. If we can do that and self-regulate ourselves, we're going to feel better. And at the end of the day, we all need social connection with each other. And we need to express ourselves and understand ourselves.
I I think Mark said it perfectly, and so much of this field, I find is, and I teach this too, is people have this idea of, well, I don't want to have those emotions. I don't want to feel angry. I don't want to feel sad. And I always say, sadness, anger, they're not fun emotions a lot of times, but they're important human processes. We need to feel sad sometimes. We need to feel angry. Name it. Don't numb it. Don't hide from it. It's not bad to be sad. It's not bad to be angry. What's bad is if I'm constantly sort of tucking it away or hiding from it or not talking about it. Because if I let things sort of manifest and worsen, then just like you said, I'm not learning resiliency skills or regulation skills. So much of what this week is trying to encourage people is that, you know what, this has been a hard year for everybody. And for us to say that we've not experienced any form of stress or strife probably is unlikely. To acknowledge that we've maybe been struggling, to acknowledge that there might be help for me available, and to reach out to that help. That's what I really see this week being a bit.
Do you think it's, this name it, not numb it and stigma? Like, I think we've always talked about the stigma being with other people, but what I'm hearing from the both of you, it's actually a stigma with ourselves.
Nicole, and something I talk about, and you mentioned Bell Let's Talk, right? And if I were to tell people Bell Let's Talk has existed for, we're on 11 years, I think people might be blown away. But about all the public perception and stigma that's sort of reduced, the athletes, celebrities, professionals have come forward and said, yes, I've been there too. I've experienced mental health concerns too. And that outward stigma of, person X lives with illness so they can't has pretty significantly reduced, at least in my sort of professional, personal opinion. What we see still really prevalent is the self-stigma. I don't have the right to feel this way. I have a good life, or I have lots of things going for me, or I've got stuff going on. Other people are more deserving of the services, support, and attention. I can't feel that way, and that self-stigma that really impedes care. I don't know, Mark, if you see something similar as well, or.
For me, I think MPAC and Nicole, kudos to your organization, is just the fact that you're having these webinar sessions for your employees demonstrates that mental health is important in your corporation. There's two sides of the coin. There's the physical health and there's the mental health, and you can't have one without the other. Your physical health impacts your mental health, and your mental health impacts your physical health, and it's a balance. And it's just understanding that we all have feelings, we all have mental health, we have good days, we have bad days, but it's that opportunity to be able to talk about it. And this session, and prior sessions that you've had, I think as a corporation, your leaders, your champions in inviting all of your staff to come and talk, and then implementing support that you're open to acknowledge and recognize. People do come to work, good days and bad days, and that's okay.
That's probably the biggest thing, if I were to look at myself in the past year and a bit, is one of the things I've written a lot about is this is the year, the 18 months of vulnerability, and not shying away from it. And I've openly shared, as Jack knows, with the staff, I have good days and bad days, and I use myself as a test case because I'm a person like everybody else. And where do you think that 25, 50-minute meeting thing came? I'm meeting too much, right? So if I'm meeting too much, everyone else is probably meeting too much because they're meeting with me and there's no breaks in between them. And so I think that's probably been the biggest growth journey for myself, is making sure that I name it and making sure that I talk about it, and then talking about it with the executive team and leadership team and the communications team, so that, we can actually bring this back to our staff and we can all grow with it. And like, I don't see any stigma anymore with it. I know it's still there, but I mean, it's something where we're talking about it more and more openly, which I think is great.
Well, as a leader, it's walking the talk. It's walking the talk. And as a leader, if you're comfortable in talking about it, more apt that your fellow employees are going to talk about it, or feel comfortable in at least talking about it. Sorry,
exactly what I was going to say. Leaders, it's a trickle-down effect. And when employees can see, a leadership takes care of their mental health and wellness, I have permission to do the same. And I think it's commendable to the whole group.
And the last point I would say, Mark, you mentioned the, the physical and the mental, they go hand in hand. And, I'm someone who's always been very physically active. And I find that, if I miss a day, which I give myself permission to miss a day sometimes on my workout, it really does affect me. Right. So what I'm trying to do, and this was actually from another speaker, is if I miss my morning workout for whatever reason, just getting out for a quick walk, power walk, around the block, 7 minutes, 10 minutes, whatever it is I can do, it really does. It really does just energize you again and make you feel that a little bit more alert and a little bit better.
It's a very real connection, proven clinically, Nicole, proven clinically.
Yeah. Movement is medicine. I heard that once.
Yeah, even in social isolation. I mean, some of the other tips, if you can't get out, and I got to tell you, it's been raining here for the last 10 days. So, sure, get an umbrella, get your boots on and your raincoat, and you should be out there. But I mean, we finally got a sunny day today. But the other is if you're shut in, let's just say, because of physical health, whatever it might be. The other thing is reaching out and talking to people, whether it's done virtually or whether it's over the phone. And I challenge everybody that, if you haven't reached out to a family member, friend, neighbor, whatever it is stay connected with people. And I think that's really key for people's mental health, is just be open and connected with people, is what's important too.
Absolutely. We're creatures of connection. We need to have it in our lives. I want to talk a little bit about COVID-19 and data. So we had a virtual leader chat with our staff last week, and it was all about data and big data and open data and so on. And there's lots of data on COVID, the numbers, the vaccines all around the world. But one thing we keep hearing is mental health is on the rise, but no one actually says what that means. I'm sure in your professions, you're a little closer to the data and what mental health challenges and numbers have shifted in this pandemic. So I'm hoping maybe you can share a little bit about that with us.
And Jack, I don't think we have a slide for that, right?
No slide, just that big brain of yours, Mark. Hit them with the stat. There's been lots of research over the last year and a half, starting with CMHA Ontario, but national, as recent as this past week, worked with University of British Columbia. They have the recent stats on the last 15 months, which basically is saying we're headed in the wrong direction as citizens of this country. So 8 in 10 Canadians are feeling more worried, bored, stressed, lonely, or sad. They're reporting 77% of Canadians reported feeling so-called negative emotions, and that 50% of Canadians reported feeling no positive emotions at all. And
wow.
From a poll done, so I mean, it's just think about that. It sounds like doom and gloom. Yeah.
It's something to consider too. Is I don't think we're going to see the true effect of this until issues with COVID and vaccines resolve. And that sounds strange, but you can imagine that many of us in the province, in the country, are in very much a survival mode in just trying to get by today. I don't have the time to self-reflect on my mental health and wellness. And once things do stabilize and I can perhaps return to work or go back to my job or stop caring as intensely for a parent or whomever, then I'm going to see that follow up of, oh my gosh, and it starts to catch up with me. And so much of what we're really trying to teach, what I'm trying to do, what we try to do organizationally through the areas that we serve across the country as a CMHA, is teach resiliency skills, is teach people how to be well, so that, if things do start to go awry, that we're going to have stuff in place to build wellness, because it's expected that we're going to see a wave. A next wave isn't going to necessarily be COVID related. It's going to be mental health, illness related. And one of the stats I always share, and I always sort of ramble off all the different courses I get to teach whenever I'm here, Nicole. One of the courses I haven't been able to teach because it can only be taught in person in 14 months is called ASSIST, Applied Suicide Intervention Skills Training, where we teach people how to recognize signs of suicide, ask the question, connect a person with care. One of the stats we teach in that course, and I've taught it again for years, and Mark will know this as a former trainer as well, in any 2-week given span in a traditional pre-COVID world, we knew that approximately 5% of Canadians, or approximately 1.7 million Canadians, experienced thoughts of suicide in a 2-week given span. As of polling data from just this last week, that 5% is up to 8%, which doesn't sound statistically significant. But if you draw a population of 37 million Canadians, you're looking at over 2 million in any week given span. We're looking at issues that I think are going to need a lot of intensive review and a lot of support. And I hope, and I know, and I can see, I'm encouraged. I know Mark is as well at some of the new funding rollout, the new program rollouts we're seeing. But we're going to need more to match the need that's going to be present.
Well, I think in this last wave, just in talking with colleagues and friends and family, it's, it's the anxiety around the vaccine and going back into lockdown and so on. But the overarching piece is this isolation, right? This isolation. Some people haven't seen their family in a year, right? Their grandparents. Like, there's so much in it, and I'm sure that must be a big data point that you guys are watching.
Nicole, and I'll say this, it's all the stuff that I taught for a decade that I said, oh, these things are bad for a person's mental health. They all happened at once for everyone. And all the stuff that we sort of expected would happen, happened. And we see it, like just the data that Mark is quoting, increased rates of generalized anxiety, increased rates of low mood, increased rates of risk of suicide, increased rates of substance use, alcohol and cannabis use. We're seeing increased across the board. And unfortunately, like I said, all the stuff that I was teaching could be bad is sort of playing itself out in front of us for many.
Yeah, and the longer I think we continue in this pandemic, I mean, they're saying that it's only going to get worse before it gets better. So I think we have to hunker down. We have to listen to the medical professions that tell you, if you're worried about the vaccine, you know what? Studies show that get the vaccine, look at the herding effect that we'll have, and we'll get out of this. But, if people just continue to, get out there and see people when they shouldn't be, or traveling, province to province without self-isolation, we're still going to continue this. And I don't know if we have the energy. I don't know about you, Nicole, but I've come to work every day for the last 15 months. And I'm not saying Jack hasn't. Like, Jack has his own issues at home because he's got 2 young children. He's trying to balance, young kids working, educating, training, and trying to do all that virtually, coming into work when he can, that type of thing. I don't have those stressors, but I have to say my stressor is coming to work every day, just making sure our organization, our staff are prepared to come to work, and our clients are being served, because it's our most complex, hard to serve clients, that have serious mental health issues that are significantly being impacted by this social isolation and this pandemic. So that's all, that's why I come to work every day, is just to make sure we're doing what we can to help our most vulnerable in our community, and support our staff for that matter.
And we appreciate all the work that you're doing, because obviously, everyone needs a leg up right now. And I don't think it doesn't matter what situation you're in. It's hard for everyone. If you've got kids at home, if you don't have kids at home, if you are leaving the house because you're frontline worker, or you're not leaving the house. I mean, it's hard no matter what age, what demographic. I think it's just challenging, because life as we know it, and we all go back to 2019 and we go, wow, remember when? And we don't have that anymore. But it's coming. I know that you guys partnered recently with British Columbia to do a study on how people are coping. And I know, Jack, you mentioned some of the negative ways, a few minutes ago about people are turning to alcohol and some other things. But what are some healthy and unhealthy coping mechanisms that people are doing right now to try and get themselves through this?
All right, Jack, jump in there.
I'll take this for sure. So we talk about let's get the unhealthy ones out of the way. I don't want to leave with unhealthy. We talk about unhealthy ways. Probably the most prominent that we're seeing is alcohol consumption. And think of alcohol, again, substances are all classified based on how they impact our central nervous system. Alcohol as a depressant. When we're feeling really anxious, what's happening to our brain is it's moving fast. It's expedited, quickly. So again, even in medicine, in treatment, we introduce depressant often to slow the response down. And you think about drugs like benzodiazepines, clonazepam, lorazepam. You might know some of these drugs. What they are depressants, they slow down my brain's operation. Alcohol is also a depressant, slows down my brain's operation. So when my brain's moving quickly, I have a couple of drinks, quells it down. People might be thinking, cool, that sounds great. Let's just do that all the time. What do we know about use and tolerance? The more I use a substance, what often happens to my body's underlying tolerance is that it increases. And I need more and more of the substance to create the same desired effect. And what we're seeing is issues of cycle or cyclical use, people needing more and more, and alcohol consumption going up and up. For me to look at two stats, I see higher rates of generalized anxiety, higher rates of alcohol consumption. Those are very clearly tied together. I don't think anyone could look at that and say those are like unilateral stats. When we talk about things that people can be doing well, I'm always sort of encouraged by it, and I hope it's being done safely. But as you mentioned it, Nicole, it's being out, being active, getting outside. And Mark mentioned too, even if it's raining, man, I'm gonna grab an umbrella and a coat and some boots and just get out and just be active, because we're inside so much. Even just the physical activity is helping my brain's chemistry. But when I do, and I can catch sunlight, and Mark's right, it's clouding over now, but it's rained, I feel like, every day. But that's maybe just my own. But again, we can catch that sunlight, get that vitamin D, help our brain's synapses form and fire. The really simple things. Mental health care does not always have to be intensive psychotherapy or dedicated medication regimes. Might be, but the simple lifestyle, sleep, diet, exercise, peer interaction and socialization, those things we can all do that I can promise you will have an impact on your health and wellness.
Yeah, I mentioned earlier, Nicole, doing something good or helpful or reaching out to, our neighbor. It could be a friend, even just like I said, it could be picking up the phone. It could be you're running errands because there's some, they try to tell you one person go to the grocery store, and it should be that same person. If you're going to the grocery store, knock on your neighbor's door, social distance, wear your mask, but ask them, can I pick something up for you? So it saves them from going out. Pick up medication or whatever it might be, or other household items. But the idea that you're reaching out and trying to help others, I think is important. And I think as Jack pointed out, yeah, routine. That's the other thing. Make sure you get your sleep. And I know that and probably many of you spend hours and hours on virtual. And I will tell you that I wane and I burn out on this stuff, but 6 to 8 hours focusing on a screen does you in. So, you definitely have to, as you pointed out, 50 minutes instead of that 60 minutes. Get off the call, shorter spurts, 10-minute break, go for a walk. Fresh air, I think, is really important. Yeah, just your routine, as I mentioned, keep your routine going, shower, when you shower, you get up when you get up, drink lots of water, lots of fluid. Those social contact, stay connected with people. I think all of those things are just important to get us through this.
So true. I
Yeah,
just
the
have
one
to
thing
really
for
echo something
everyone.
for Mark, that just the routine. Sorry, Nicole, he's just, people thrive on structure and routine, and Mark is so right. And think about how many of us have lost that. I've lost my commute. I've lost my sort of normal morning because I'm trying to get the kids on virtual class, or I'm trying to get myself out the door, or I'm not even going out the door now. I got to figure out if I'm starting my day. Did I start emails early? Did I start late? Let's set structure to the day. Let's set a designated workspace in my home. Let's give myself a morning commute. That's a walk around the block 5 minutes before I start my day. Build that structure, and I can't echo it enough. I think that's a great point from Mark.
No, absolutely, because all of our routines have shifted, right? But I think the one thing that sort of resonated with me recently, and we've heard this term before, it's self-care. I think that has to be your new routine. you need daily, weekly, monthly self-care. You need to take care of yourself because that, it includes the physical, which helps with your mental, whatever it need be. But definitely self-care is the new routine. I think we all need to embrace.
There's one
Build
thing
it
I
into
want
your
to,
calendar.
there's one thing I want to add, Nicole, and I think from an employer's perspective,
Mhm.
and being in the mental health field, I truly believe that, as leaders in mental health, Jack's on our management team, and it's all about, people want to contribute. We've adopted a hybrid model of support where our most vulnerable clients are being seen face to face, but we've offered staff the ability to work from home, work in office, and work at home and virtually work or in the community to see clients. We know that people are not working at 100%, but if I know you're putting in 80% of your work schedule and you're meeting your targets, the one assurance people also want is income to pay their bills,
Mhm.
to feed their kids or to feed themselves, whatever that might be, or pay your mortgage, whatever that is. We're trying to guarantee that from an employer's perspective, because that's the last thing people need to know is that, oh, my employer's going to lay me off because I can't function or I can't do my job. So we've been really fortunate from this end that our staff, we've proper PPE'd their equipment and the likes, and they've been able to actually come to work and contribute, and our clients are being supported and served well.
No, that's an excellent point, and I spoke about that right from the beginning of the pandemic with all our staff, and I'll say it again. I mean, our number one priority is the health, safety, and wellness of our employees, and we know that everyone is working at different capacities. As you say, some people are not able to put in the same amount because they're homeschooling, and some people are doing too much, right? So we need to help each other. And you know what? I will tell you, this organization. They deliver. They deliver. They get their work done. We've done things differently, so I have full faith in all the staff. But I do want them to know that we are here for them, and we want to support you in all of this because we know it's hard, and we know there's still some more waves to come of uncertainty until we actually, as you say, get back into whatever our new normal looks like as we go forward. I want to run a poll with our staff, and what's good about this poll that we're going to put up here, it's going to ask a little bit about how people are feeling, but it's actually a very similar poll to what we ran early last year when we had Anarada on with us. And so I just want to get a little sense from our staff what the predominant emotions are that they've been experiencing in the past few weeks. And as we know, in the past few weeks, it's been the third wave, but it's also been hope with vaccines, and there's spring coming, or spring is here and summer is coming. And so the options are anxious, frustrated, optimistic, confident, or too many emotions to name just any. And it was actually May of last year. So it's almost exactly a year ago that we ran this poll. So I think it'd be really interesting to see what people would pick on here. And maybe I'll pick on both of you. What would you answer? Because I know we don't get to push the button.
I was going to vote, and then I see I'm not allowed to vote. So
I know. You got to verbally vote.
I have to verbally vote. So I'm gonna say optimistic. I'm gonna carry an optimistic belief. I'm excited about vaccine rollout. I'm seeing people starting to really get passionate. I'm gonna carry an optimistic tone. That I'm going to be able to see fans in the stands when the Maple Leafs hoist the cup in July. That's how optimistic I am.
Good for you. What about you, Mark?
Well, I beg to differ with Jack and the Stanley Cup and the Maple Leafs, but I will take that up with him a little later. But I'm optimistic that the Habs are going to win the Stanley Cup. Just kidding. No, back to the question. I'm optimistic as well. Clearly, we've from our end have been able to vaccinate a lot of our most vulnerable citizens in our community. I'm assuming that's happening in across the province. 80% of our staff have been vaccinated. So we've got 180 staff here, 140 of them have been vaccinated so they can do the work they need to do. So I'm definitely optimistic that we're going to get through this sooner than later.
Oh, that's great. All right, let's see what comes up. Not as many optimistic as the two of you, but it looks like frustrated is number one, followed by too many emotions, followed by anxious, very little confidence. So I will tell you that last year at this time, the number one was too many emotions, to name just one, followed by anxious, frustrated, and finally optimistic. So I'll come clean. I would have put too many emotions for me, because it said in the last few weeks, and I was really frustrated with the vaccines and trying to get an appointment and so on. So while I was really optimistic they were coming, it was really difficult to actually get in. Now it seems to be rolling out a little bit quicker. I'm an optimist by nature, so I know that there's a light at the end of the tunnel, and I know that we're going to get through it. But it is frustrating when the numbers are going up, especially when we're in lockdown. Right? You just keep saying, like, how is this happening?
How perfect is this analogy to the mental health week? It's we're not going to hide from it. Let's be real with the emotions we're experiencing. Let's get real with what's going on. And if we're frustrated, we're annoyed, we're angry, that's not bad. That's not wrong. Feel it, sit with it. Sometimes, again, I remember one of my old health promoters I used to have on my team. She used to say to me, Jack, just telling people just to sit with their emotions sometimes is okay. I think, like, man, that's really smart to sort of think of. So just being with an emotion, I think that's okay too.
Well, I'm going to ask you both of your professional experience. So we're all feeling emotions, as you just saw in the poll. What can we do? Like, what are some of the what are the signs that we should be looking for? What is it that we should be looking for either in our family, our coworkers, and in ourselves? And what can we do if we're struggling?
I can take a swing first, Mark, and I'll pass it to you if you want. I think whenever I talk about what am I looking for, so one of my concerns, the first thing I always want to preface with, when's the right time to access mental health care? Whenever I want it. I do not have to reach a point of clinical diagnosis, of major disruption in my life, where I finally say, okay, now's the time. Think of mental illness like anywhere else in health or medicine. Early recognition, early treatment, greater rates of recovery. If I'm seeing anything in my life that I think would benefit from any type of formalized mental health support, I encourage people to access that, to pursue that. That said, what would I always sort of be keen to is disruption or impairment in functioning. Am I noticing the feeling, the mood, whatever I'm experiencing start to disrupt my ability to live my day-to-day life? I can't sleep. I'm not eating. My appetite is disrupted. I'm isolating, or I'm not socializing, I'm not connected, I'm not finding enjoyment in activities I normally would. I can't do my job or focus at work or care for family. If I'm seeing impairment in functioning, that to me is something that would really more strongly suggest directing towards formalized care. I don't know, Mark, if you have any thoughts as well?
Yeah, I mean, I guess if you're recognizing whether that's a family member, whether that's a colleague or a peer or whatever it is, whoever it is, and you see, just as Jack's pointed out, person's not sleeping well, person's not attending at work in a timely manner, they're not focused, whatever it is. I mean, I really truly believe that, it's incumbent upon us all to either reach out to that person or that person reach out and talk to someone. And I think if you're open and receptive to actually, I guess, recognizing and dialoguing with that person, that's the first step to reducing, the stigma. We don't talk about this. We don't bring our problems to work, whatever that might be. But once you frame it and you know it, and it exists, and you can talk about it, you're going to feel better about it. And it's okay to have, emotions. Just as the survey says, you can feel anxious, you can feel frustrated. And that might be a negative emotion, but at least it's an emotion as opposed to aphasic, and you don't really care, or if you've given up, then it becomes a little worrisome.
Absolutely. Name it, don't numb it, right? That's the theme.
Yeah.
Now, Jack, I want you to talk a bit about when you and I spoke last week, you mentioned something which I've been thinking about it a lot since then. We're planners at MPAC. And fortunately, we actually had a business continuity plan, and we did a tabletop exercise on a pandemic a couple months before the pandemic started. So that's a good, story as to why planning is important. And one of the things that you said to me was, we get emotions, but once you're in crisis, it's hard to think straight. And so we should actually come up with a mental health crisis plan in advance when we're not in that crisis. So maybe you could share a little bit about that, because I think that is something that all of us could benefit from and all of us should do.
Oh, absolutely. And I'll say this, Nicole, in this field, in medicine in general, a lot of times we take sort of a reactive approach, don't we? We wait until the illness presents and we deal with it, we treat it and carry on. It's almost like a post-ventative measure. Wait till the problem arises, deal with the problem, and you think even that business continuity plan is designed to do the exact opposite of that. Let's prepare before there's a problem. So if the problem arrives, we know exactly what we're going to do. Thus, we could deal with it much faster, more efficiently, more effectively. Mental health and mental illness is the same idea. If I wait until there's an issue, if I wait until there's strife or concern or disruption, how much harder is it going to be for me to navigate complex systems, to find the appropriate care, to find out what's going to be my best course of action for treatment when I'm already struggling, versus if I built a plan when I was well. So we actually offer a group in-house at CMHA, and many mental health organizations across the province, across the country offer a group. It's called WRAP, W-R-A-P. It stands for Wellness Recovery Action Planning. And one of the documents I've sent along that I believe, and I'm going to say it now, put Nicole and the gang in the background on the spot, should be going out, right, Akila? Akila's nodding, or you're either furiously shaking your fist at me. Either way, going to be going out to everybody to help to start to build those plans of what are my local resources? What is my local crisis number? What mental health services are available in my community? Are they accessible to me? What's the process for them? It is so much easier to sort that stuff out when I'm doing well than when maybe things are happening very quickly. So I encourage people to check out the document we're going to send along to start to explore. Even just take the time today, when we're done the session, you've got 10 minutes. I know you've got 10 minutes for your next meeting. Take
Sure.
and start to reflect in on what are the resources available to me in my community.
Well, that's great. And so what we're doing, just so everyone knows, is we'll be doing a follow-up article on the intranet, and we're going to have that resource, that WRAP document, so that we can all start planning. And I agree. I mean, it's better to plan when we're nice and calm as opposed to in crisis mode.
Absolutely. You've been there with family. I've been there with family members too, where, gosh, I wish we had this documented down before we tried to figure it out Saturday at 2 a.m. or when my little sister's calling me and I'm driving to work or whatever's happening. It'd be a lot nicer to have it sort of laid out. And that reminder again, don't just teach it, do it. So a reminder to all of us, you can all do this pretty simple.
Perfect. So that's for ourselves. And Mark, I want to pick up on something you said, is often we see some signs in our colleagues. We see that they're not operating the way they normally would be. What tips do you have for us to sort of look for those changes and then just to provide support to them?
Yeah, I think from our organization's perspective, I mean, clearly, as Jack pointed out, there are some provincial programs right now that have been launched by CMHA. If the listeners here, if you Google Bounce Back Program, it's a resource across Ontario. I think it's expanded across Canada. So that's one.
Across Canada.
Yeah, it's there's expanded psychotherapy, structured psychotherapy program for the province. I think the other thing is just every employee is different. Don't treat everybody the same. Understand that each person's going to react differently. I think it's engaging with our employees, listening to their feedback, and offering them some suggestions. And being flexible, I think, as an organization. And if you were structured during this COVID, I don't think you'd survive. I think you would be struggling. I think it's all about change, and we've rapidly changed as things have progressed, and waned with the pandemic. And I think if you're just open, receptive to hear what staff have to say. We've offered wellness, just like this dialogue, this conversation, allowing them input and opportunity, and that you got their back. I think at the end of the day, if they know, you believe in them, you support them, and you're behind them, employees are going to go the distance for you. They're going to work twice as hard, especially during the most difficult times, especially during COVID.
I agree. And we have, I'm going to ask not to put the slides up. We'll put them up later, only because I'm going to keep to this 2:50 time limit. But we do have a slide of all the CMHA resources that we'll put on the intranet. And we also have a slide of all of the MPAC resources. So we'll do that following the call. But I want to talk about now, like something I like to talk about, which is you have to have fun too. I mean, we talk about work and we're talking about coping and so on. As I mentioned at the beginning of the call, we're going to do our first MPAC Wellness Day coming up, but you guys are in the business. What are some things that some organizations can do to also bring a little bit of levity and have a little bit of fun with your employees? Maybe you can share some other ideas with us.
Well, I can give you the one thing I always say whenever I do any type of consulting or work with organization is, people say, what should our organization do for our employees? And I'll say the first thing you can say back is, did you ask them? Did you ask them what they wanted to do? Because that's your best bet. And you know what? I hear Wellness Day, I hear feedback. One of the things that Mark and I have actually been talking about to run for staff, we did these sort of education days. We're thinking about bringing in a virtual stand-up comedian to come in to deliver some just some levity in a day. Again, in a day that can feel very heavy, just to laugh a little bit. But whatever we do it with people. We do it with an employee. If I were to sit here and Mark, if Mark were to sit in this chair there in his office, that's just across from mine, and say, okay, here's what we're doing for all our employees. I don't care what they think or say. Maybe it's a hit, maybe it's not. But if he opens his door like he always does and says, hey, we're thinking of doing something. What would you guys benefit? What do you guys want? What could we do that would help you? All of a sudden, there's that much more buy-in. So whenever I'm going to suggest what's the best practice or policy or feedback for my staff, what can I give to them? Ask them. Just ask.
Okay. So we're asking. So if you guys want to put that in the chat function, because we look at those later, or send an email to the Hour Communications, or send an email to any of us. We all read our emails. So I love that. I want to end on a happy note. What gives you hope in all of this? I know right from the beginning for me, I've said, let's not waste a crisis. We've reinvented ourselves. We've tried to do lots of great things, but what gives you hope based on where we're at right now?
I'll go and I'll let Mark, I'll end it if you like, Mark. I'll say for me, what gives me hope is we've made it through waves before. When we've done something historically, it lets me know we can do it again. And to see again that people have come together. Another thing that gives me hope is that even though this is a horrific sort of pandemic that's happened, it started a lot of amazing conversation and the focus on mental health and wellness and each other and caring for each other. And if that's what we come out of this with, is that we're that much more apt to care for one another, I think we're going to have a great sort of start to 2022, is what I'll say.
I like that. Thank you.
We're not alone. We're not alone. This pandemic has impacted all of us. I do think there's great ideas. Keep the communication open. No idea is a silly idea. The other thing is, seriously do your homework. If you haven't been vaccinated, listen to the medical profession. We've got to look at the herding effect. You've got to vaccinate. And I know there's some that have trepidation, and I'm not being paid by any drug company, but I'm just saying, you got to vaccinate in order to protect yourself and others at the end of the day. So I think Jack and I are both optimists. The same, well, Nicole, maybe we've convinced you to be an optimist at the end of the day.
Oh, I'm an optimist. I'm just being honest. I was naming my emotions for the last few weeks.
No judgment here. No judgment here.
That's okay. And you're also an optimist when it comes to sports teams. So it.
Yes,
yeah,
I am.
Our executive team would weigh in on that if they were on the call here with me.
I can imagine.
Well, I want to thank both of you for coming on with us, and I want to thank you for the work that you do in the community and in helping people and helping each other. I think it's really, really important work, and you both do it with a smile on your face, and so we're all very appreciative of all the work that CMHA does. And it was great to see you, Jack, and great to see you, Mark, and thank you for joining us.
Thank you, Nicole.
Okay, have a great day, everyone.